In Georgia, Joe Biden is ahead by 14,116 votes. So, on Friday morning at 9 a.m., the hand recount audit begins. That's expected to go until Wednesday. In North Carolina, Donald Trump is ahead 71,399 votes. So it's clear to virtually everyone that Joe Biden won and is our president-elect. But Donald Trump doesn't know how to concede or lose gracefully, so he's raging. In this case, against CISA, the Cybersecurity and Infrastructure Security Agency that Trump himself established in November of 2018. Well, on Thursday night, CISA contradicted Trump's voter fraud conspiracies, saying unequivocally there's no evidence of any voting system being compromised in the 2020 election. In response, or more likely retaliation, more firings. Yeah, this time, Valerie Boyd, the top official for international affairs at the Department of Homeland Security, and Brian Ware, a senior policy aide at CISA, the Cybersecurity and Infrastructure Security Agency, were both shown the door. And the warning flag is up around Cybersecurity Chief Christopher Krebs, who everyone is worried could be fired next. But all the news is not bad. Let's look at some of the good news that came from this election. Americans showed up to vote big time, breaking all voter turnout state and national records, and they're not even done counting yet. So far, 63.9% of Americans eligible to vote cast a ballot in the 2020 election. That's the highest percentage since 1908, when it was a record 65.7% turnout. On the state level, turnout in all but 8 is projected to exceed 40-year records, with Minnesota and Wisconsin coming in at close to 80% turnout. Overall, total 2020 turnout is projected to rise to 66.5% once all the votes are tallied. That would be the highest since 1900, when there was a 73.7% turnout among eligible voters. But keep in mind that there was a much smaller pool of eligible voters back in 1900 and 1908, as women, Asian Americans, and some Native Americans could not vote, and other non-white Americans were discouraged from voting through Jim Crow laws and other intimidation tactics. The other big story of the day, also being ignored by Trump and his administration, is, of course, COVID-19. U.S. public health officials reported 164,405 new cases on Thursday, obliterating the previous single-day record set on Wednesday. It was also the first day since the pandemic began where the country has seen more than 150,000 new infections. It was the 8th straight day with more than 100,000 new cases. And hospitalizations for COVID-19 rose to 67,096 patients, also a record. All this according to the COVID Tracking Project. Hospitalizations have doubled over the last 5 weeks, and deaths, which tend to rise shortly after increases in new cases, are already averaging more than 1,000 a day. In a number of states, governments are tightening restrictions on public and private gatherings to curb the spread of the virus, including the city of Chicago, where a new 30-day stay-at-home order begins Friday morning. And as expected, new COVID-19 cases with ties to Donald Trump's orbit continue to climb. On Thursday, 3 more came to light. Corey Lewandowski, obviously an advisor to Trump, Jeff Miller, a top advisor to House Minority Leader Kevin McCarthy, and Richard Walters, the chief of staff at the RNC, all tested positive. And go figure, Lewandowski and Miller were both at the election night celebration at the White House. In the 10 days since the event, a few individuals close to the president have tested positive, including White House Chief of Staff Mark Meadows and Department of Housing and Urban Development Secretary Ben Carson. And that's just a bit of what's news for now. I'm Nicole Sandler. If you appreciate these reports and the Nicole Sandler Show, I hope you'll consider making a contribution. My work is 100% listener supported, and I can't do it without your help. Find out more at NicoleSandler.com, and please click on that donate button.
The Leslie Marshall Show, the only true democracy in talk radio, of, for, and by you, the people. Live nationwide and streaming live at lesliemarshallshow.com. Call in with your thoughts at 888-6-LESLIE.
Don't be looking at me, be listening to me, although you could look at me tonight on Special Report, 6:45 p.m. Eastern, with host Brett Baer and a great panel for the All-Star panel tonight, plus winners and losers. Hope you'll tune in on Fox News Channel, where you know I am a contributor. And if you don't, I am a contributor. I'm Leslie Marshall, host of The Leslie Marshall Show, appropriately named, don't you think? Happy Friday. Thank you for joining me and glad to have you with us. Just want to say once again, thank you to all of our veterans, as it was Veterans Day this past Tuesday. Thank you for your service. My dad was in the Navy. He fought in the Korean War. I have a cousin who fought in the Persian Gulf War. He was a Marine. I have an uncle who was a part of the Air Force, because a lot of the people, myself included, my family, have flat feet, and you cannot be in the Army if you have flat feet. Not just then, but apparently still now. My Uncle Harry, who's gone, like my dad, fought in World War II, and he fought actually as a Jewish American. It was very personal to him, not just patriotic. So let me see, who else in my family has been in the military? Oh, sorry, and my cousin, Matthew, who was in the Navy, but he was not in any combative role. So I've got some great veterans in my family. And I'm very grateful for the freedoms that I, as an American, especially an American woman, and especially with what I do, that I have the privilege of. Thank you to those who fought for that very freedom, willing to give their lives, and some who actually did just that. Well, right now on this Friday, it is time to kick it and check what is ripped from those headlines. New coronavirus infections have jumped by 40% over the past week. The United States now averaging roughly 119,000 new cases per day. That is by far the highest daily average on any point in this pandemic. Now, the United States really has never controlled the coronavirus. It would seem right now, while we're still in this administration, we're not ready to start either. Cases rose over the past week in 40. You know what? And I just want to say, I'm on TV with him a lot. Charlie Kirk really upset me the other day. My husband's a physician, and I remember patients crying because he couldn't operate on them because there were elective surgeries that were stopped from, 2 to 3 months, depending on what state or hospital that you were in. I'm in California, Southern California, in Los Angeles County. And, the healthcare workers are just being overburdened. So and I mentioned Charlie Kirk because he posted something on Twitter and I responded, but there are many people doing this. Hey, for Thanksgiving, let's have a big bash. Let's have a big gathering and get together. That is so irresponsible. So irresponsible. And if you are a human being and you're sticking your middle finger up to doctors and to nurses, how dare you walk into the emergency room crying when you can't breathe? How dare you? We are all in this together. This is not political. The virus doesn't ask, are you Democrat or Republican? Who did you vote for? The virus will attack you. And you may have an underlying health condition and you don't know. The virus is a virus. It's just going to attach to any host. And we, the humans, are the host. Now, the vaccine isn't going to make it go away and make our lives return to normal right away. That's a reality. What we need to do is to stop acting like petulant children who are being dragged like toddlers out of Chuck E. Cheese and wear our damn masks. You wear a seatbelt. If you go into a bar when you're at the beach, you got to put on your damn shirt and your flip-flops because shirt and shoes are required. That's the law. Or the health department, by the way. So please, if we want this to be behind us, let's look at countries who've actually done that. If we need to shut down for a few weeks and somebody's going to help us financially with our government being led, I hope, in the right direction, in a better direction with our new outcome and our true president-elect Joe Biden, let's stop being red and blue. We all bleed red. Let's stop having that attitude because, quite frankly, karma's a bitch. And you know what? It comes for all of us. I don't want to bury any of my loved ones from this damn virus, neither do you. Think of those people. Stop being so damn selfish and self-righteous. This isn't about infringing upon your freedom. I don't know who it was who said the other day, you know what? You know what's worse than your freedom being infringed upon? Dying. And that's it, folks. That's it in a nutshell. Wear your damn mask, social distance, don't have these gatherings. It's irresponsible. It's wrong. And to promote that is disgusting. Could you imagine sitting at the bedside of somebody who's not your relative and holding their hand because their family can't be with them while they die a very miserable death as they can't breathe and they choke to breathe? This is no joke. This is not a slap on the hand. Don't be an idiot. Please listen to the medical professionals. Please listen to the scientists. What are you doing? And what example are we setting as a nation for our children? If you go into a doctor's office and they say if you don't quit smoking, you could get lung cancer, and then you get lung cancer, and you cry and you whine and you want medicine and you want treatment, I'm sorry, but my violin stays in the case for you. Let's get back to this. Cases rose over the past week in 45 states. We have 50 in this country, and held steady in the other 5. Not a single state saw an improvement. The number of people who are sick enough that they need to be hospitalized, higher than it's ever been, still climbing. Nearly 62,000 Americans are in the hospital for coronavirus infections. And by the way, there are hospitals saying, we can't take you. We don't have enough beds. Do you know what we are doing to the medical community? Do you know what we are doing to our nation? Do you know what we are doing to our families? And do you know what we are doing, since we love ourselves so much, to ourselves? The United States is now conducting just under 1.4 million tests per day. That's up 11% by necessity from the week before. And the problem is we have more cases for those tests to find. Cases up nearly 40% this week. Look at the testing. For people say it's testing. Testing's up 11%. No, cases are up 40%. It's not because of the testing. It's because we're raging. We're surging. Seriously, I just want to take you and shake you. Those of you who don't realize how serious this is. What will it take? Somebody you love being put in a coffin as you watch them being lowered into the ground and you go, duh, should have worn my mask. Experts have long believed that winter would be a dangerous time, and not because temperatures take much of a biological difference for the virus COVID-19, but because it spreads more easily indoors, which we already knew. More indoor socializing, holiday travel will likely cause cases to keep rising. My mother is 81. Is she 80 or 81? I can't keep track. I haven't seen my mother since December 25th. Of 2019. I have never gone that long without seeing my mother. And my extended family, who I see every Christmas. This will be the first Christmas that I am not with my extended family, just with my husband, my 2 children, and our dog. Thanksgiving, would always go see my husband's family. His 4 brothers, his parents, his aunts, his uncles, nieces, nephews. Not doing it. We're not going to put them at risk by getting on a plane and catching God knows what and exposing them and ourselves and our children to that. We're going to do our own family celebration on those holidays. Not what we wanted, what we have to do. It's what we have to do right now. Experts, like I said, had long believed that more indoor socializing would be a problem. Holiday travel, it causes cases to keep rising. Infections are also spreading widely in places where it's still warm, by the way. Here in California, we topped 1 million. Florida's still raging. Texas and parts of Texas warm. The last big spike in cases happened over the summer, if you remember, with regard to warmer temperature. Winter is not our only problem. It just exacerbates our failure to stop the virus spread. Let's rip another. More than 130 Secret Service officers are quarantining now due to positive coronavirus test or exposure to a coworker who has tested positive. That comes from reports from the Washington Post. Now, officials told the Post that they believe the cases at least partly stem from President Trump's run of campaign rallies before Election Day. The number of officers forced off duty, roughly 10% of its core security team, could stress the Secret Service at large, forcing overtime and missed days off to make up for the strain. A former senior Secret Service supervisor told the Post, quote, being down more than 100 officers is very problematic. That does not bode well for White House security. The Secret Service outbreaks come as the White House is experiencing another coronavirus outbreak of its own, just weeks after one that left the president himself infected. Chief of Staff Mark Meadows, HUD Secretary Ben Carson, Campaign Advisor Corey Lewandowski, all tested positive, and those are just a few that have. Trump has not yet addressed the rise in cases, has largely avoided public events in the last week. That's Rip from the Headlines Part 1. We'll be back with Part 2 after this.
If you're worried your friend may be struggling, remember, you don't have to be there to be there.
You could say, how are you, or get a fake tattoo. You can ask with an app if it works for you. You could write them a text or knit them a sweater. If you can't be together, you could write them a letter. Whatever gets you talking. Whatever gets you talking. You could chat on the game, kick off your flip-flops. You could ask on your couch while you binge watch. However you do it, you gotta ask a friend. And if they don't share, you can ask again. Whatever gets you talking. Whatever gets you talking.
Reach out to a friend about their mental health. Learn how you can help at seizetheawkward.org. Brought to you by the Ad Council, American Foundation for Suicide Prevention, and the JED Foundation.
I was in the middle of the Atlantic Ocean when it happened. There was a sudden jolt and our submarine crashed on the seafloor. We were in total darkness.
That's Dr. Dejana Figueroa, a marine biologist and STEM teacher, talking about a deep sea dive she'll never forget.
It's funny, when I was a kid, I was afraid of the ocean. And there I was, 2 miles below the surface. But as a scientist, you prepare for that. Using our training and a little creativity, we fixed the sub and finished our experiments. The dive was just too important. Every dive gives us glimpses at things few people ever get to see. Glowing creatures, fiery undersea volcanoes. When we got back to the surface, I kissed the ground and called my mom, of course. But you know what? I wouldn't trade that dive for anything.
Dr. Figueroa uses her passion for STEM to discover new things and make the world a better place. She can STEM, so can you. Check out She Can STEM for more stories and inspiration. A message from the Ad Council.
I'm Rick Smith, and this is Labor History in 2. On this day in labor history, the year was 1974. That was the day Karen Silkwood was killed in a mysterious car crash. Though her death was ruled a one-car accident, some maintain she was forced off the road. Silkwood was a union activist and representative for Local 5-283 of the Oil, Chemical, and Atomic Workers. She worked at Kerr-McGee's Cimarron plutonium plant in Crescent, Oklahoma, making plutonium pellets for nuclear reactor fuel rods. Meryl Streep popularized her life in the 1983 film Silkwood. Karen's union loyalty only grew after the company crushed a strike in 1972. She was elected to the Union Bargaining Committee just as the company moved to force a decertification election. She also served as a union health and safety rep. Silkwood found a number of apparent violations: routine contamination exposure, faulty respiratory equipment, falsified inspection reports, and improper storage of radioactive material. She met with OCAW leader Tony Mazzocchi to highlight safety issues in a campaign to beat back the decertification. It worked. Karen testified before the Atomic Energy Commission, worried about her own contamination. It was clear her home was contaminated too. She worked tirelessly to gather the documentation and the evidence detailing the company's life-threatening negligence. And on this day, Karen Silkwood was headed to Oklahoma City to meet Mazzocchi's assistant Steve Wodka and a New York Times reporter to present the evidence she collected. She never made it. Her car was found with rear end damage near skid marks in a ditch along Route 74. While the company attempted to smear her as a drug-addicted lesbian who deliberately contaminated herself, they would eventually settle with her family for nearly $1.4 million. Karen Silkwood became a model and hero for women workers and all those who fight for safe workplaces.
If you miss Leslie on TV this week, catch up at lesliemarshallshow.com.
I guess I can go? Yes. Anyway, I'm Leslie Marshall. Welcome or welcome back. We're going to have our second half of Rip from the Headlines now. Let's kick it and check what further is ripped from those headlines. If you want to know why public health officials are so nervous about how much worse the COVID-19 pandemic will get as the holiday season unfolds, well, consider what happened after a single, smallish wedding reception that took place this summer in rural Maine. How that turned out. Only 55 people actually attended that reception at the Big Moose Inn in Millinocket on August 7th, but one of those guests arrived with a coronavirus infection. And over the next 38 days, the virus spread to 76 other people. 7 of them died. Did you hear me? 7 people out of 55 died. Now, 55 spread to 176. More than 3 times the number of the people that attended the wedding got the virus. 7 people lost their lives because they had to have that reception, not social distance, and not wear their masks. By the way, none of the 7 attended the wedding. So do you understand why I say, when you talk about having a big Thanksgiving bash, not social distancing, and not wearing your mask, maybe nobody in your household will die, but maybe somebody in mine will. Or a friend or a neighbor, maybe somebody you don't even know. But how dare you take away that child's mother or father? Or adult's mother or father? How dare you take away one or both of the breadwinners for that family? Maybe leave a woman and her children, if she's a stay-at-home mom, without the financial support from her husband because he lost his life, because you just wanted to stick your middle finger up to Democrats, blue states, and Joe Biden. What's wrong with you? What kind of a person are you? You can't call yourself a human being if you're not acting human. It is inhumane to personally, intentionally, and purposefully take actions or refuse to take actions that will result in endangering another. You know, it's interesting because in a court of law, that could be called attempted murder. It could be called manslaughter. It could be called aiding and abetting. It just blows my mind. Seriously, there are people in other countries watching our country, scratching their head going, what the blank? Ireland, the UK, New Zealand, Italy, Spain, France, South Korea, Germany. They're going, what the blank? Doctors are telling you, please wear a mask. You'll be helping others. Ooh, that didn't work. Now they're saying, you know what? We're finding out if you wear a mask, you're helping others and yourself. That still doesn't work. Look, if you all want to die, don't wait for COVID. I mean, seriously, if you want to die, don't, how irresponsible. I don't know about you. We're all going to die, but I don't want to get there sooner. I certainly don't want my children or anyone that I know and love, and by the way, or anyone I don't know or love, to get this terrible virus. And I don't want to further burden our healthcare system. I see how tired my husband and other health care professionals are. And if you're in the healthcare industry, or you're married to one, or living with one, friends with one, a relative of one, you know that face that I'm talking about. It's overwhelming. It's overwhelming. Now, in a new report, investigators found regarding that Maine party, that from the Maine Center for Disease Control and Prevention, they explain how a well-meaning celebration with family and friends wound up causing so much suffering and death throughout the state in such a short period of time. I know some people might say, oh, just 7 people died. Those are 7 human beings. Those 7 people have families. And those 7 people suffered because somebody else said, I want to get married. It's not a big deal. We'll just have a reception. It's a big deal. Now, to the main health officials who wrote the report, the lessons are clear. Wear a mask, practice social distancing. For goodness sake, don't go to work when you are sick. By the way, don't go anywhere if you're sick. The market, a gathering, a gender reveal party. You know what I'm saying? Community gatherings such as weddings, birthday parties, church events, and funerals have the potential to be SARS-CoV-2 super spreading events. They remind everybody. And the risk is higher when people gather indoors, something that is likely to occur over the winter holidays. The findings are in the Morbidity and Mortality Weekly Report. It is a publication that comes out of the U.S. Centers for Disease Control and Prevention. Let's rip another. Doctors close to President-elect Joe Biden's transition team are working to develop their own plans to mass distribute a coronavirus vaccine. They're concerned that the Trump administration planning will leave them unprepared when he leaves office, underprepared. Now, President Trump's ongoing refusal to concede and his administration's unwillingness to acknowledge that Biden is going to be our president means that those working to develop the vaccine distribution plan cannot start to share the plans with those who will take over in January. According to Ron Klain, Biden's incoming chief of staff, in an interview with MSNBC yesterday, he said, quote, we're in a COVID crisis. Right now, there are officials inside the Department of Health and Human Services who are busy planning a vaccination campaign for the months of February and March when Joe Biden will be president. So the sooner we can get our transition experts into meetings with the folks who are planning the vaccination campaign, the more seamless the transition. Again, irresponsible. Tell the king he's naked. The emperor has no clothes. He's a grown man, not a child. Stop enabling the behavior. The physicians working with Biden's team have been in contact with CVS and Walgreens. They see as key distribution points for the general public. They've been tracking whether the retail pharmacies will have the staffing and the supplies needed to vaccinate millions of us here in the United States. The Biden team also has been in contact for months with Pfizer as it tries to sort out the sub-zero storage requirements for the company's vaccine. And Trump aides have continued to insist that the Republican president will prevail in litigation, which alleges mass fraud, but have so far failed to provide details. They're like, 0 for 10, 11, or 12 at this point. You have a law firm pulling out, lawsuits being dropped in the states of Nevada, Arizona, rejections of lawsuits in states like Pennsylvania, Michigan, and Wisconsin. And even as Republicans continue to echo Trump, have begun to push for the administration to allow some transition steps to begin. Now, Republican senators have started to call for Biden to receive intelligence briefings that would be access to critical information about our nation's security and actions abroad. They've not yet made calls for Trump to let Biden access coronavirus response information. Now, Eric Toner, a senior scholar with the Johns Hopkins Center for Health Security, said they are not yet allowed to talk to people in the government, which is a particular problem for this issue. Now, he is not involved in the transition, but he went on to say, for this issue, really getting an understanding of the details of Operation Warp Speed and what has been communicated to the states and what their plans are, that is something they're really going to need to know. The sooner they can have access to that, the better. Pharmaceutical companies are racing to develop a vaccine that could help return the world to normal after the COVID-19 pandemic has hobbled economies, killed more than 1 million people globally, and getting an estimated 300 million doses to Americans after it's approved. It's very obviously going to produce its challenges. Mass inoculation could begin in the weeks before Biden takes office, January 20th. The Trump administration has developed a plan, parts of which have been made to the public, but they rely heavily upon the military, and Joe Biden doesn't have that information. Trump's coronavirus task force met earlier this week on Monday for only the second time, by the way, since October 20th. The president has not regularly attended those meetings, and today his public schedule did include an update on Operation Warp Speed. The Trump administration has laid out the broad outlines of its strategy publicly, including its plan to use an existing contract with drug distributor McKesson to transport the vaccinations to locations where it will either be administered to the public,
hey,
like
Dad,
hospitals or retail.
How do airplanes fly? What's in this box? Can I touch this? Where does sand come from? Is this tree good for climbing? What happens if I mix these two things together? How are babies made? What does this thing do?
Kids are curious about everything, including guns. Talking to them about gun safety in your home is a good first step, but you can do more. Always keep your guns locked, unloaded, and stored separately from ammunition. Storing your gun securely is the best way to prevent family fire, including unintentional shootings. For more information on safe gun storage and ways to keep your family safe, visit endfamilyfire.org. That's endfamilyfire.org.
What do we keep in the attic? What's this thing called? Can I ride my bike backwards?
Like I said, kids are curious. It's up to us to keep them safe. Brought to you by End Family Fire, Brady, and the Ad Council.
Wake up and text. Text and eat. Text and catch the bus. Text and miss your stop. Wait. Text and be late to work.
Sorry, I'm late.
Text and work. Text and pretend to work. Text and act surprised when someone calls you out for not working.
Who, me?
Text and meet up with a friend you haven't seen in forever.
Hi.
Oh, hey.
Text and complain that they're on their phone the whole time. Text and listen to them complain that you're on your phone the whole time. Text and whatever. But when you get behind the wheel, give your phone to a passenger. Put it in the glove box. Just don't text and drive. Visit StopTextsStopWrecks.org. A public service announcement brought to you by the National Highway Traffic Safety Administration and the Ad Council.
Welcome to Code Whack, your podcast on America's broken healthcare system and how Medicare for All could help. I'm your host, Brenda Gazar. Today, we'll continue our discussion with Hollywood dancer and choreographer Aisha Orange, who appeared in all 3 Austin Powers movies. The longtime SAG-AFTRA member and single mom is coming to terms with benefit changes that are leaving her and her young son without health insurance.
So they raised the amount of money you had to make. Is it per year?
Yes. It went from $13,000 to $25,000 something.
Okay. And if you don't make that money, then you don't qualify for their health coverage.
Correct. Or it's a certain amount of days that you have to be on set, which was 100 days. What dance job has been going on anywhere for 2020? This could not have been the most inopportune time for someone to make such a drastic move to, I think it's 11,000 people, the poor seniors.
Have you read or heard about Medicare for All, which would provide universal health coverage for all residents regardless of their employment status? What are your thoughts on a system like that?
It would be great. I would vote, I would picket, I would totally do what is needed for everyone to be covered. I know some people who haven't been to the dentist for years because do you know how much a cleaning is? It's $100, I believe. Some people don't have it.
Get the full Code Whack story on ProgressiveVoices.com and on the PV app. You can also listen to our episodes at www.heal-ca.org. This podcast is powered by Heal California, a nonprofit that uplifts the voices of those fighting for healthcare reform around the country. Until next time, stay healthy.
We are back. Happy Friday. I'm Leslie Marshall. We're going to be joined shortly by a great guest. I'm very excited. We'll be coming on Dr. Eric Feigl-Ding. He's an epidemiologist. I always say that wrong, but I said it right. And health economist and a senior fellow at the Federation of American Scientists in Washington, D.C., and chief health economist for Microclinic International. We're going to be hearing from him shortly. We're just getting the technical stuff connected. And in addition to that, if you don't follow him on Twitter and haven't seen his tweets, he is just a plethora of information, all things COVID. And I'm very excited to be talking to him just a few minutes from now. But want to continue sharing with you some information about ripped from the headlines. We were talking a lot about COVID, but let's talk a little bit about politics. Joe Biden is the apparent winner in the state of Georgia. Now, that is a NBC News decision desk. There are projections in Georgia and North Carolina. NBC is the first network to make calls in the presidential race in every state. The final electoral count, 306 to 232. Interesting, 306 was the number Donald Trump won by in 2016, and 232 is the number Hillary Clinton lost by in 2016. So it's the exact inverse of 2016. And remember, President Trump called 306 a landslide back in 2016, despite the fact that he had lost the popular vote to Hillary Clinton by more than 3 million votes. This time around, though, millions more votes are still to be counted, and that's in mostly liberal states like the one I'm sitting in here in California and also in New York. President-elect Biden already has earned over 78 million votes for people that thought there wouldn't be enthusiasm and voter turnout for him, giving him roughly a 5.5 million vote lead over President Trump. Now, by the time all the votes are counted, President-elect Biden is expected to beat Donald Trump by over 7 million. That. Just to let you know, the total population of people that voted for Joe Biden is more than the population of 27 states in this country combined, magnitude of that. So excited to have this next step with us. I can hear you, Mark. You're on the air.
Yeah. Hi, Leslie. Hi, Mark.
Hi. Okay. Are we on the air with the doctor? Yes, we have. Okay, sorry, guys. We have Dr. Eric Feigl-Ding, as I mentioned, an epidemiologist and health economist and a senior fellow at the Federation of American Scientists in Washington, D.C., and chief health economist for Microclinic International. Now, in January of this year, he was recognized in the media as one of the first to alert the public on the pandemic risk of COVID-19. He's part of FAS's work to stop COVID misinformation and communication with the public. Previously a faculty and researcher at the Harvard Chan School of Public Health and Harvard Medical School between 2004 and 2020. Please follow him on Twitter. Like I said, he's a plethora of information at Dr. Eric Ding, DrEricDing. Dr. Feigl-Ding, thank you for joining us. I am so excited to have you on the show today. I repost almost everything that you tweet, and I do find you just a huge source of information. Thank you for being with us today.
Thank you. Thank you for having me. I'm just trying to do my best to share as much as I can.
Okay, just a quick overview where we're at. The United States is surging. It was expected to happen in winter. It's not even winter fully everywhere, like where I am here in California. It's probably 79 degrees outside and sunny. This isn't just about winter. It's about people being inside, but it's also about people refusing to wear masks and refusing to social distance. Is that correct?
Yeah, there's a lot of things that has gone wrong in this pandemic response. I think mask wearing is one of the most unfortunate. It shouldn't even be a brainer. I would say that lockdowns and business restrictions are much more frustrating. But masks it's such a minor inconvenience, but could actually make such a huge difference. And the fact that there's a culture war and misinformation, disinformation campaign around it is just so ludicrous. So I would say that is a frustration thing. And the other thing is people realized that it was an airborne virus too late. In Asian countries, Japan, South Korea, and Taiwan, they assumed this virus is aerosol. It's a respiratory. You breathe it. If it's something related to you breathing, they assume naturally it was an airborne virus. But we didn't recognize that it was airborne until really late. And all the 6 feet rule. Now, 6 feet is important, but 6 feet is not enough when it's an airborne virus. It's just trying to keep your distance is an oversimplification. It is important, but an oversimplification because, someone could have been heavily breathing in a room, left for 20 minutes, and then you enter, but that could infect you if this room is full of airborne aerosols of this virus. So there's so many things we've gotten wrong, and I can go on talk about Trump and everything he's done as well, but it's so frustrating.
Yeah, and my husband's a physician. He's an orthopedic surgeon. Although he doesn't deal directly, he does have patients that have had COVID, or he's operated on patients with COVID. It certainly affects him and others in the medical community with regard to elective procedures. And there are people, I know people, patients of his that were in pain with torn ACL, rotator cuffs, meniscus, tears, the list goes on, that were in excruciating pain, and he could not operate on them for almost 90 days here in the state of California. And we're fearful that's where we're headed again. When we see those numbers, doctor, of people entering the hospital and the burden that's being placed on healthcare workers, there are just so many things that come through my mind. There's a mental health aspect of not just the patient, but of the healthcare worker that we're, in a sense, putting them through again. How do you as a physician feel when you see, I saw a post and it just really chafed my hide this week, a very conservative person who I debate on TV, and others out there who were saying, you know what, for Thanksgiving, let's gather. Let's not have our freedoms infringed upon. What can you speak as a medical professional as to what we as a nation who are not social distancing, who are gathering indoors and not wearing masks, what we are doing to our healthcare workers and to the healthcare community?
Yeah, we're really endangering them. So I'm not a physician. I'm an epidemiologist.
Right.
Research scientist. So what we really also needed was PPEs, these personal protective equipment, from good quality masks and shields. And at the beginning of the spring, you could argue, okay, maybe we were caught off guard, even though we knew it was going to be a pandemic in January and February. But we were caught off guard in the March-April wave. But by now, by the second peak, by the third peak that we are seeing now, there should be no excuse. We should have invoked the Defense Production Act, and doctors should not have been using trash bags as gowns. They should not be reusing their N95 masks so much. And it's almost ludicrous. And right now we have epic shortages. In North Dakota, they have such a doctor and nurse shortage that they're being told, if you test positive, keep working. If you have COVID, keep working, because we have no other doctors. We don't have enough to go around, and people will die if you have a mild case. Please keep working. It's so frustrating, and so much of the right now we're exceeding the healthcare capacity. The flatten the curve thing we used to talk about in the spring. The whole point is that how many people die depends on basically if the hospitals are overloaded, and we're reaching that point where hospitals are overloaded. And that means doctors are being endangered. That means patients are being endangered, and so much is at risk. And if we lose our healthcare doctors and nurses,
right?
You can try to replace beds, right? You can add more beds and ventilators. You can't replace doctors and nurses overnight. This is where we're headed, and next month is going to be really, really bad.
We're going to take a quick break. We'll be back with Dr. Feigl Ding. He's sounding the alarm that he believes that it could be the U.S. when you see an article in Newsweek magazine that COVID-19 patients are receiving oxygen in cars in Italy because the hospitals are overwhelmed. We'll talk to him about that. We'll talk to him about lockdown. We'll talk to him about the new administration coming in and what he would advise, in his opinion, on the coronavirus task force that Joe Biden and his administration have put together. I'm Leslie Marshall. Stick around. More to come right here with our guest, Dr. Eric Ding. Follow him on Twitter at Dr. Eric Ding, D-R-E-R-I-C Ding. Back with you right after this.
Follow Leslie on Twitter. Just go to www.twitter.com/Leslie Marshall, and we'll be sure to share your tweets.
America, your children have an amazing superpower. They can help save lives by not having play dates. That's right. By replacing get-togethers with virtual play dates and video chats, they can help slow the evil spread of germs. And if your superheroes do go outside, make sure they continue their superhero wing by staying 6 feet away from others to protect everyone in America land. Find out more at coronavirus.gov. A message from the CDC and the Ad Council. America, your children have an amazing superpower. That's right. They can help save lives by simply washing their hands. Just 20 seconds of thorough hand washing after they've coughed or sneezed or been outside can help fight against the dastardly spread of germs. Armed with only soap and water and hands, your superhero can protect you, your family, and everyone out there in America land. Amazing! Find out more at coronavirus.gov. A message from the CDC and the Ad Council.
He was the heart of your family, and he taught you our history. He helped you fix your first flat. He was the best backyard DJ around, and every time he'd tell a story, he'd own the room. But now more than ever, he may feel alone. Today, older adults and their loved ones are struggling to connect, in a time when connection has never been more important. But there is something we can do. Embrace our older loved ones through StoryCorps Connect. With StoryCorps Connect, you can honor seniors remotely with an interview about their life. Every interview will be archived at the Library of Congress, becoming part of American history, so that years from now, future generations can listen in.
All right, Grandpa, what's one piece of advice you have for me?
Just 3 words, sweetheart. Live with courage.
The man that had the best stories still has plenty of stories to tell. So connect virtually and share the conversation of a lifetime at storycorpsconnect.org/AARP. Connect, honor, share.
Top regulatory officials in Trump's government keep chanting the same one-word mantra: deregulate, deregulate, deregulate. Day after day, these agency bosses have been liberating greedy business interests to do their damnedest to us consumers, workers, the environment, and even to our chicken dinner. Yes, chicken. Instead of Kentucky Fried or tacos con pollo, they're serving up chicken a la avian leukosis. That's chicken infected with a virus that produces cancerous tumors and lesions on the birds. In July, the U.S. Agriculture Department's Food Safety and Inspection Service rubber-stamped a demand by Tyson Foods and other multi-billion-dollar meat conglomerates to deregulate chicken processing rules so they can sell chickens diseased with avian leukosis for human consumption. And no, the huge brand-name marketers would not even be burdened by having to put a right-to-know label on the package so we consumers could know what we're buying. As always, the industry line is, "It's perfectly safe. Trust us." No. Their claim is that slaughterhouse line workers can simply cut out any tumors they see, then process the rest of the animal. There are 2 problems with this claim. First, avian leukosis can be a systemic disease passing through the blood, so slicing tumors doesn't necessarily eliminate the virus. Second, line workers don't have time to see tumors, much less remove them, since Trump's corporate-hugging regulators have also allowed poultry factories to speed up their processing lines to 175 birds per minute. This means each worker handles up to 3 chickens a second. As Lyndon Johnson used to say about such political hokum, they can't make chicken salad out of chicken shit. To learn more, go to Food and Water Watch, foodandwaterwatch.org.
If you missed Leslie on TV this week, catch up at lesliemarshallshow.com.
Happy Friday. Welcome back. Welcome back. Dr. Eric Feigl Ding. I'm a big fan of his. And as I mentioned, follow him on Twitter at Dr. Eric Ding. I'm not going to go through all of the great stuff in his resume because I want to get to him and talk about a few things. Dr. Ding, thank you for holding. Welcome back, Dr. Feigl Ding. Listen, there are people, that for campaign purposes, Donald Trump and his campaign during the political race before Donald Trump lost this election, have said that Joe Biden's going to lock the country down. They're going to take away your freedoms. Would a lockdown have been such a bad idea at the beginning of this thing? And would you recommend that if Joe Biden, called you tomorrow, President-elect Joe Biden called you tomorrow and said, Dr. Feigl Ding, what would you recommend I do?
Yeah, I would say lockdowns are this really, really difficult thing that normally you want to avoid. But if you do it, you don't want to waste it. They do work. They are definitely the best thing when there is a flashpoint of a really bad surge and you want to cool it down. We've seen it work tons and tons of places. Israel has had a really bad outbreak, and then they locked it down, and now they're almost back to really pretty low levels again. But the problem is, what do you do during that time? It buys you time. It's one of basically dropping huge numbers of water from the top of a wildfire with these tankers. But the fires and the embers will keep burning unless you swoop in immediately after and put out the fire. And that's the thing. We should have done it very quickly and very aggressively, and then stopped it and nipped it in the bud where it was. Or we should just move and do it in a way that supports people, that they can sustain it for a long time. Because there's lockdown fatigue, there is distancing fatigue, and we know it works, but we should have done an enormous amount of testing and contact tracing with it. And at the end of the day, it's something we want to avoid, because then kids are also out of school. But had we done everything else along with it, plus mask, plus ventilation, funding during that time, funding air improvements, HEPA filters for our schools, and then reopened, we would be a lot better. But right now, we are kind of squandering it, and the lockdowns that we are doing are very laissez-faire, half-assed. And that's the problem. We are shooting ourselves in the foot long term, and we're not even doing it right, like other places that have done it right and basically stopped the virus altogether.
You've probably had a look at the list of people that the Biden, team, the Biden administration, incoming administration, have chosen to be on the coronavirus task force. Are you happy with the names that you're seeing in some of their picks?
No, that list is really great, and it's a really great start. It's a 12-member task force at the moment. A lot of them are clinicians. A lot of them are virologists and immunologists. A lot of them previously worked as FDA head surgeon generals. But the one thing I noticed is that it's lacking, in terms of risk communications to some degree. And obviously this is just the start, and there will be lots of other people. But in terms of reaching the people and making them understand, I think in certain ways that they're just hoping that they have a spokesperson who can alone. But I think reaching people, especially in this misinformation, disinformation age, I think will require, getting the word out and getting people to do these interventions in an earnest way. It requires more than just pure medical and basic science expertise. And this, in certain ways, this is why I spend a lot of time on Twitter, because there are certain things you have to say in a certain way to make sure people hear the message, right? Sometimes you have to be funny, you have to be creative, and because unless people hear it and do it, it's not going to sink in, and the intervention is not going to work. And oftentimes, a person who smokes knows that smoking is bad for them. They know, they still do it. But there are certain things you can say and do to convince them to stop smoking. And this lockdown, doing lockdowns is difficult. Wearing masks for some people is difficult. Understanding ventilation is difficult. There are ways we have to get people to do it. And so I'm really looking forward to next year. Next year can't come fast enough. And I think the Biden administration will take science seriously and actually carry out these public health recommendations.
Speaking of next year, before the end of the year, hopefully next year, there will be vaccinations or a vaccine available. How much of a game changer is that? Because, obviously this is quicker than we've ever seen anybody have a vaccine turn around with studies and whatnot.
Yeah, vaccines definitely will work. And there's about over 10 in phase 3 trials right now. There's actually much more than that if you count other additional vaccines in development. And we need as many different as possible because, some require boosters, some don't require, freezing, which is much easier for transport. Some could last longer. And I would say it will be such a huge game changer. But the problem is, it's not like everyone will be vaccinated overnight. And so there's going to be like this small throttle releasing as you add more vaccine. And of course, you have to fight the vaccine misinformation, because you could have hypothetically, 100% effective vaccine, efficacy vaccine. But if only 50% take it, you've got a 50% vaccine. And so right now, the problem is only 1/3 say, Americans say they will definitely take it. 1/3 say they definitely won't take it. And 1/3 that says, I'll wait and see. I'm hoping that wait and see means they will take it eventually once Dr. Fauci
but we still have that time period.
Yeah. But the thing is, still 1/3 of the people. So say we have this 90% effective vaccine, which, we still have to follow for much longer. It's a very early result. 1/3 of people don't take it. We've got a 60% effective vaccine, effectively, in terms of population. And that is good, but that's not sufficient in absence of anything else. We definitely still need to mask, ventilate, filter, and distance to some degree in order to really slow it down. Because our goal is to bring it to zero. Right. There are people who say, of course, there's the crazy ones who say herd, infect everyone, build immunity, which means get everyone sick, either die or have chronic debilitating illnesses. That's crazy. And then, there's so much more than that. And I'm part also advising Survivor Corps of people who survive these long-term illnesses. And it's just incredibly risky. But we cannot just let this spread. And the goal is to get to zero so that we can have kids playing, kids interacting, hugging each other eventually. You seeing your grandparents or relatives who are elderly. All that, in order to return to normal, we need to be back to zero.
Absolutely.
Not just, a minimally acceptable casualty rate.
Absolutely. I have read that 1 in 5 COVID-19 patients are diagnosed with a mental illness within 90 days of becoming positive with COVID-19. What is that about? Why do you think that is?
Yeah, so that was a study of people 60 days post-discharge. Actually 90 days. But that is a very worrisome number, 1 in 5 people. Now, granted, some of the people previously had a mental diagnosis, but whether it's a flare-up again or what's a new diagnosis, 1 in 5 is an enormous number. And it's 1 in 5 of any combination. But it's, having these cognitive deficits, it's really bad. And it affects people even if you aren't hospitalized as well. If you're hospitalized, it's worse, but even if you're not hospitalized, you still have this. And they actually calculated in another study that among those hospitalized, they took this cognitive test, and it is equivalent to an 8-point IQ drop for someone who was hospitalized and recovered, and their cognitive deficit over a month or two is equivalent to 8-point IQ drop. That is humongous. And even those with milder non-hospitalized cases still had like several points of IQ drop. These are things that will affect the workforce, will affect our lives more, and there's so much more than death. And so we cannot ignore this. And this is on top of every other cardiac condition you're also going to get long term. So it's very worrisome.
We have less than 60 seconds. So just in 1 or 2 quick sentences, Senator Rand Paul, who survived COVID, says millions of COVID-19 survivors should throw away their masks. We don't know if you're immune to getting COVID, right?
Yeah, it is so crazy. That is one of the most ludicrous comments. And for him to say that as a medical doctor who has clearly lost his way against all medical evidence, it is so derelict, so dangerous. And when there's a reckoning for all the things that terribly happened, Rand Paul's name will be on that list of things that went wrong and people who've made that pandemic worse.
Doctor, thank you for taking time with us. I know you're busy. Dr. Eric Feigl Ding, thank you for being with us. Follow him on Twitter at Dr. Eric Ding, DrEricDing. More than a pleasure to have you with us. Like I said, follow him on Twitter. He's a plethora of information. I love the information. I turned my husband on to you as well, too, Doctor. Thank you for all that you do, not just, in your position, but sharing that with the public via social networks like Twitter. Thank you. I'm Leslie Marshall. Have a wonderful weekend. Marky Marcomaldi is our executive producer. Shout out to him. And